Healthcare professionals are healers, not data clerks. Yet today, many spend half their day on a computer navigating their EHRs and other systems. Since a patient's health records are sometimes scattered across multiple systems, getting a full picture of a patient takes up valuable time, energy, and resources. The tools we're developing for health systems, like our collaboration with Ascension, aim to make health information more accessible and useful. We're committed to understanding the unique challenges clinicians face, as well as the concerns and preferences of their patients. Today, I'm joined by Dr. Richard Fogel, Chief Clinical Officer at Ascension, to dig into the potential clinical impact of our work. Dr. Fogel, welcome to the program. Let's start with taking a step back. When we think about organizing information, what challenges have you and your clinicians been facing that prompted your company to seek a tech solution?
Thanks, Paul. I've been a doctor for a little bit more than 30 years now. And when we started out, we were using paper records. And if you saw a patient for the first time or the second time, the chart was relatively slim. But as you saw the patient longer and longer, the chart got bigger and bigger and bigger. And frankly, finding information in that chart got harder and harder. It became like a scavenger hunt. Around 20 years ago or so, we converted to digital format. We converted to electronic health records. And you would think that that would have made the process easier. And in fact, it did make it easier, but it still created a problem. You see, the way that electronic health records or paper charts were organized, they're organized in different sections. And very often we want to find a specific piece of information. And the piece of information is in a section, but it's not the only piece of information in the section. So for example, I'm a cardiologist. I'd like to find an echocardiogram or all the echocardiograms that a patient has had over time. Echocardiograms are typically in the imaging section, but so are chest x-rays and CT scans and MRIs and many other imaging tests. So often, even in today's electronic health records, what I have to do is I have to sort through that imaging section to find the exact information that I want to see. That can be very time consuming and can take me away from being with you, the patient. And we began to think there just had to be a better way.
Finding data like that can be really difficult. And so one of the key things we're doing here is, our teams are creating a harmonized and normalized view of data across multiple systems. Now, thinking about this multi-system view, why is that so important? What are the risks associated with relying on a siloed data?
If everyone worked on the same electronic health record or the same database underlying the electronic health record, that would be great and that would make things a lot easier. But that's not the current reality. There are multiple different electronic health record systems, and information comes into it in many different ways. Sometimes it comes in digitally, sometimes it's scanned, sometimes it's faxed. It becomes a mishmash of different types of data, and that mishmash makes it really difficult to really understand what's going on and get a complete picture of the patient. The reality is, the better picture of the patient that I can get, the better the information is organized, the better care I can give you as a doctor, the better I can present you with information and options, and the better choices we can make together for the betterment of your healthcare.
Agreed. So let's say we now have all this data in one place, and we've done the hard work to normalize it and made it searchable. How does it actually plug into the day-to-day workflow for clinicians? How does it enable you to deliver better care?
So when I see a patient, or I think when most docs see patients, we typically see patients in the outpatient setting in the office on every 15 minutes or every 20 minutes or so. So in my particular workflow, what I like to do is I like to review the record before I go in and see the patient. I like to see how the patient was doing the last time, and then I like to see if there were any updates to the patient's condition. The more efficient I can do that, the more time I can spend with the patient. If I'm seeing patients every 20 minutes or so, and it takes me 5 minutes to review all the information, including all the new information which has come in, then I have 15 minutes with the patient. But if it takes me 7 or 8 or 10 minutes with the patient, and I have a 20-minute appointment booked, I can see the patient in only 10 minutes. So it takes time away. So the more the information is brought together, the easier it is for me to integrate the information, for me to form a picture in my mind of what the patient's needs are and to present that information to the patient for good decision making. Some docs like to take the computer into the office, into the exam room with the patient. And one of the issues with that is if you have to search for information and you can't do it efficiently, then what can happen is you're looking down at the computer and you're not making eye contact with the patient. And it's so important to have that critical doctor-patient bond that you can have by just looking at a patient and looking at them in the eye and looking for all the nonverbal cues. The better the information is presented to me, the more efficient I can be, the more time I can spend with you, the better care we can give, and the better decisions we can make together.
Amazing. In the end, we hope to save time with better workflows and ultimately improve outcomes by helping clinicians find that information they need to care for patients, because that's what it's all about, patient care. Thank you, Dr. Fogel, for your insights. It's an absolute pleasure working with you and your teams.